Hello, this is Dr. Katsaros, and I have created a YouTube video of my perioperative instructions that you may find useful. If you're about to have surgery with us, we have already gone over these instructions, but we will repeat them during your perioperative course. Nevertheless, I thought I would include a YouTube video of my perioperative instructions as an additional reference. Before surgery, remember that you should take no solid food, caffeine, carbonated drinks for 12 hours prior to the surgery. So basically don't eat anything after midnight on the night before surgery. Since you will have bandages for much of your postoperative course, it's probably a good idea to take a bath or shower on the night before surgery. Try to use Hybocleanse soap if you can, but if you don't have Hybocleanse soap, you can use your own soap. It's important that you bring all your postoperative and perioperative medication to the surgery facility so that we can go over them with you. Wear loose-fitting clothing, bring your underwear, or if you prefer a bathing suit for your before pictures. Also bring an extra long t-shirt. A cotton t-shirt is better, and preferably something that's got buttons in the middle, because we'll use that t-shirt to put it between you and the binder, which can be itchy sometimes. Don't use perfume, underarm deodorants, or body lotions. Don't shave in the area that we're going to be operating for 24 hours prior to the surgery. Leave all your jewelry at home, and you must be accompanied by an adult on the surgery day. This will be your driver. Your driver can just drop you off, in which case we'll call your driver to pick you up when you're ready to go. If you do not have transportation, you can arrange to use Uber. Before surgery, it's a good idea to stock your kitchen for 1 week with easy-to-prepare, low-maintenance food. In this way, after surgery, you do not have to go to the grocery store for shopping. Instead, you just go home and become a couch potato because you've already done your grocery shopping. So, some of the things to get from the grocery store include clear liquids, and this includes things like sports drinks, Gatorade, juices, popsicles, Jello. Avoid carbonated drinks. You can also have fruit like watermelon and grapes. Also get yourself some full liquid diet, which is basically soups, and light soups are preferable, such as chicken soup, a vegetable soup, rice soup. Avoid heavy soups like chili, for example, or beef broth. Also get yourself some solid food like easy to prepare TV dinners like lean cuisine dinners. Avoid heavy solid food at the beginning. Anything that flies or swims but not fried is usually good, such as chicken, turkey, fish, and vegetables, but not fried. On the day of surgery, we will first ask you to go to the bathroom so that after you wake up from anesthesia, that's one less thing you need to urgently do, which is not having to go to the bathroom. We will also review your postoperative instructions and medication, and then we will also take before pictures with or without video, and we will mark the areas for surgery. Pictures and or video are all part of your private medical record. They are not shared or uploaded to social media platforms unless you give signed consent. After obtaining signed consent for the surgical procedures, you'll also meet the anesthesia specialist who will come and talk to you about anesthesia and obtain anesthesia consent. About 30 minutes prior to surgery, we will start giving you some of your postoperative medication so that you can get muscle memory in using them and familiarity so that you can easily transition to postoperative taking your medicine. Just before surgery, we will ask you to take your 2 antibiotics. We will also apply the scopolamine patch, which is for nausea, either behind your ear or the base of your neck, and it's good for 3 days. You will also be given your oral Halcion for anxiety. You will also be given your oral narcotics 30 minutes before surgery, which will make you more drowsy and give you analgesia prior to even having the anesthesiologist start an IV on you. After surgery, it is not unusual to have no recollection of even walking into the operating room. So if this happens to you, don't be surprised, it's not unusual. In either case, you will be ready to go home when you have minimal pain, are not nauseous, and are able to keep clear liquids down, or in our case, we give you grapes as well as watermelon if you like, besides clear liquids. Also, you should be able to ambulate to the bathroom with assistance. And also, tummy tuck patients are reminded that they should walk with the palms of the hands touching the knees for the first 24-48 hours. Also, tummy tuck patients are going to have drains, which you will get instructions for how to manage the drains from our nurse. Do not remove your dressings until seen by me, usually 2 days after surgery. It's not unusual to have bloody discharge from the liposuction areas or the drains for the first 24 to 48 hours. If you have bloody discharge from any of the liposuction areas or drain sites, you can apply your own dressings on top of the ones that we have placed, but do not remove our dressings. A wheelchair will be provided to you, which you may take if you choose to you at home. The postoperative visit is usually 2 days after your surgery. However, I tell my patients that if they need to call me or text me prior to the 2-day postoperative visit, they can call or text me anytime. It is important to know that even though you will be able to be awake, you're wide awake after surgery, the intestine may take several days to be fully functional after anesthesia. For this reason, it's a good idea to start with clear liquids diet and gradually go to full liquids and solid. If you tolerate your clear liquids well after 24 to 48 hours, you can then advance to full liquid diet. If the full liquid diet seems excessive, go back to clear liquids. If the full liquid diet seems adequate and it's going down okay, then you can advance to solid food. But remember, when you first do the solid food, keep it simple. If it flies or swims, eat it, but don't deep fry it. The first postoperative visit is 2 days after surgery usually. On that first visit, the main idea there is to mainly remove the dressings. We will also take pictures on your first postoperative visit. On this first visit, I will ask you if you've had a bowel movement, and almost always the question is no. I will ask you if you've had gas or passed gas. Almost always the answer is no to that as well. And depending on your fluid status, I may ask you to take furosemide or the water pill with potassium either the postoperative day, the second postoperative day, or the following day. It is very common to not have bowel movements for 5 or more days after surgery. In this instance, I will direct you to take a stool softener if you do not have a bowel movement for 5 days after surgery. After adjusting the binder on your first postoperative visit, you will be able to go home with either the wheelchair or a walker that will be provided to you and follow up with us in our office in 1-week increments until fully recovered. Long-term recovery and results are better if you stay away from sodium, so a low sodium diet will make your recovery much better, much more cosmetically pleasing. The low sodium diet is the same as the modified Mediterranean diet that we advocate for optimal health, and we go over this diet postoperatively. If you have any additional questions or comments, do not hesitate to call or text either our office phone number or my personal cell phone number. Thank you.